Hello, this is a video on mitral regurgitation, its effects on the body, and how you can treat it. So what exactly is mitral regurgitation? It is when the mitral valve can't fully close, allowing a backflow of blood into the valve. Symptoms. Some may not experience any symptoms for a few years. Others will experience abnormal heart sounds or a heart murmur, shortness of breath when active or lying down, fatigue, heart palpitations, swollen feet, or in mitral regurgitation is often mild or progresses slowly. You may be unaware you have the condition. Some of the causes of mitral regurgitation include when the mitral valve located between the left atrium and left ventricle does not close tightly enough and allows blood to flow back through. Mitral valve prolapse. The mitral valve leaflets bulge back into the left atrium during a heart's contraction. Damaged tissue cords. Tissue cords that hold the mitral valve flaps to the heart may stretch or tear. This may require surgery. Rheumatic fever can damage the mitral valve. Endocarditis. Mitral valve may be damaged by an infection of the lining of the heart. Heart attack. It can damage the area of the heart muscle that supports the mitral valve, affecting the function of the valve. Abnormality of the heart muscle. Cardiomyopathy. Conditions such as high blood pressure, which cause the heart to work harder, gradually enlarge the heart's left ventricle and stretch tissue around the mitral valve. Trauma. Congenital heart defects. A baby may be born with a damaged valve. Certain drugs. Some drugs, particularly those with ergotamine. Radiation therapy. Rare cases in radiation focused on the chest. Also atrial fibrillation. You're at an increased risk if you have a family history of mitral valve problems, heart attacks, which can damage the heart, use of meds, infections such as endocarditis or rheumatic fever, a congenital heart disease, and your risk increases with your age. Complications. Mild does not usually cause any problems, but severe can cause heart failure. The heart doesn't pump enough blood to meet the body's need. A backflow of blood puts a strain on the left side, while fluid acclimation in the lungs puts pressure on the right. Atrial fibrillation. The stretching and enlarging of the left atrium, which leads to irregular heart rhythm. Pulmonary hypertension. Mitral regurgitation leads to high blood pressure, which affects the vessels of the lungs. Facts. It increases pressure of the left atrium, increases pressure in veins, congestion. If severe, the heart may enlarge to maintain blood flow. Here are the sources that I used to help make this video. If you feel like any of the symptoms apply to you, please go and talk to your doctor.